Poso maoni wiak, waiwanan kitana ni mua e yoski piataya posnotaman e yum MITW Podcast. A yospis piataya posnapi notaman e ne hisikimaka e yoso matnameneha kihi.
Welcome to the Menominee Indian Tribe of Wisconsin podcast. We are your hosts, Gary Dodge
and Sheena Wapus. On this episode, we are joined by Vaughn Bowles, Public Information Officer for the Menominee Indian Tribe of Wisconsin. I'd like to remind everyone that we request you send in your COVID-19 related questions to us at podcast@mitw.org. Welcome, Vaughn.
Hi, guys.
So, just first thing off the bat, can you update us on who is available to be vaccinated right now?
Yes. So right now we're finishing up the 1B section. But this morning we received an all email from Jonathan Wilbur, our tribal administrator. He said that we're moving forward and vaccinating all tribal employees at this point. Today from 12:30 to 4, they're having a walk-in vaccination clinic at the Menominee Indian High School. No appointments needed. And, it's available obviously while supplies last. So we're moving forward on all of our tribal employees. We're working on our elders over the age of 55 and anyone that has any sort of autoimmune or immunocompromised condition. And that's for anyone that is in the county and or reservation borders.
Can you still transmit the virus after being vaccinated?
The answer is yes, and that's because the vaccines are 95% effective at protecting you from the virus and from getting infected. So while that's a pretty amazing rate for a vaccine, it still means you have about a 5% chance that you could contract COVID. And in the event that you did get sick, you still could transmit that to other people despite being vaccinated previously.
This kind of goes with that question as well. Do we need to continue to wear masks and social distance after being vaccinated? And if so, why?
At this point, the answer is a yes. And it comes down to a numbers game. At this point, nationally, there are only about 17% of the population that have been vaccinated. In Wisconsin, that proportion is slightly lower. It's only about 14% of the population. And so even at the most optimistic levels, that's nowhere near herd immunity, which is, has been moved from 50 to 60% up to the, 70 to 90% range. So yes, you'd still need a mask because there still is that, potential for spread. All said, the tribe's actually ahead of the curve as far as vaccinating the population, and we've vaccinated about 2,200 community members at this point. But the surrounding areas are still lagging behind, so still take those precautions. Wear those masks, do social distancing while you're out shopping in the communities and surrounding areas.
Kind of off the cuff question for you.
Yeah, go for it.
So if you're socializing with people that you've been vaccinated, they've been vaccinated, what's the rules there?
I have to weigh in on the side of caution and say, social distance still, please, use masks if they're not within your immediate household. But yes, it is safer if everyone has been vaccinated at this point.
Can you take pain relievers after getting your COVID vaccine to help deal with side effects?
All right. So first, let me state for the record, not a doctor, and this answer shouldn't be taken as medical advice. So keep that in mind. I do know, however, that Dr. Schlegel has recommended Tylenol or acetaminophen for individuals that have been experiencing some more exaggerated side effects following the vaccination. And that's a big but this was after that patient had given the doctor a full list of symptoms and the timeline of onset. We don't want anyone self-medicating following vaccination because we don't know if they're accidentally masking some of the initial symptoms of, a potentially serious reaction. So if you're experiencing heavy COVID-like symptoms following your vaccination, call the Menominee Tribal Clinic and consult with one of the medical providers and see what they recommend based on your medical history and, your associated symptoms.
Is the vaccine safe for those with autoimmune disorders?
We're going to say yes with an asterisk on this one, and here's why. They're still not sure how effective the vaccines will be for individuals with autoimmune disorders because those demographics are typically excluded from a lot of the preliminary studies that the vaccine needs for approval, like the phase 3 trials that you hear for the EUAs or the emergency use authorizations. Additionally, the vaccine also depends on your immune response naturally generating antibodies and T cells. And if you're on medications or have a medical condition that alters your body's ability to generate normal T cells, a patient might not reach that 95% protective threshold that's normally seen within the vaccine in other groups of the population. All said and done, though, receiving a vaccine for someone that has an autoimmune disorder is far safer than them, contracting the virus and trying to fight it off. So we still recommend that even if they have an autoimmune disorder, they get vaccinated.
Okay, so there's some talk about having a third dose for the Pfizer right now. Will we be required to have more than 2 shots at some point?
Right now, we're not planning on administering a third dose, and to my knowledge, the manufacturers haven't recommended a third dose. Now, this isn't to say that you're not going to need another COVID vaccine later on down the line in the future, because they're still working on a lot of long-term studies regarding how long the COVID immunity lasts. So, this may be like a flu shot where we need, 1 a year. We don't know that yet. But right now, we're not doing like a series of 3 shots all in a row for protection.
Okay, how does the new Johnson & Johnson vaccine compare to Pfizer and Moderna in terms of effectiveness?
So Johnson & Johnson, depending on the studies and the trials they've been looking at, has been effective between 66 and about 85% effective at preventing people from getting affected with COVID-19. However, the Johnson & Johnson vaccine only requires 1 dose. So it should be noted also that Johnson & Johnson hasn't been given an emergency use authorization or an EUA by the CDC. So right now, Johnson & Johnson vaccine isn't even available in the U.S. for us.
Okay, will the tribe be receiving Johnson & Johnson vaccines in the future?
That really depends on whether or not it gets an EUA. And also if the state decides to start purchasing doses of Johnson & Johnson. We partnered with the state for, procurement and distribution of the vaccine. So if they decide to go with that in the future, we might start using it. But as of right now, we're just using the Moderna vaccine.
Okay, thank you. Is there anything else you'd like to add?
Thank you for all your efforts. We've maintained a pretty low level of new COVID infections at this point. The community is doing a great job of keeping it out of the community, and we just recommend that people keep up the precautions they've been doing to make sure that we don't have pockets of COVID popping back up and stuff. So thank you for that.
Waiwanan for listening to the Menominee Indian Tribe of Wisconsin podcast. You can find us on Apple Podcasts, Spotify, and Stitcher. You can also listen to the podcast on menominee-nsn.gov under the Community tab. Keep up to date by following us on Facebook at MITW Podcast. We do weekly updates with Vaughn, and we welcome any community questions you have regarding COVID-19, so please send those to us via email at podcast@mitw.org.